If you are allowed to choose only one, only one supplement in order to maximize your health, what what would it be? The answer is magnesium. In the next succeeding slides, I am going to show you or the level of your magnesium during heart attack. I gathered 20 patients with myocardial infarction and show you the level of magnesium in their blood at the time of heart attack. Now, why magnesium is the number one choice? Because, like I said earlier, it involves more than 300 enzymatic reactions in our body, including the production of energy, ATP. Imagine if you are deficient with these magnesium ions, and this is a cofactor of more than 300 enzymatic reactions in the body. How many diseases or pathological conditions you will suffer if you are deficient in magnesium? Deficiency in magnesium is actually common to almost all of the disease in the body. Majority, from diabetes to high blood pressure to heart attack, kidney disease, multiple sclerosis, all almost all of the diseases in the body, magnesium is deficient. Now, our body is composed of electricity. We have electrical conductance in our body, and this homeostasis, this electrical conductance is regulated by a sodium potassium pump and other channels, calcium channels. They are regulated. Now, in a normal excitation state, in a normal tissue, that during excitation, there is a depolarization and increase in electricity in your cell. Normally, the cell in a resting state is negative 70 millivolts in neurons. Now, during depolarization, the sodium ions get inside the cell, and at the level of negative 55, the calcium channel is activated and causing an increase entrance of calcium inside the cell. So there is a sodium and calcium increase inside the cell during depolarization, but then the potassium inside the cell will leak out, causing polarization to hyperpolarization and then bring back to a resting state. That is in a normal tissue. But in an abnormal tissue, where the tissue is at rest, during depolarization, sodium ions increase as well as calcium, and there is a retention of sodium and calcium, and this is now swelling or or pain in your nerve or muscle cramps. But in the case of cardiac muscle, this is a heart attack. There's prolongations of depolarization before it brings back to resting state. So if you look at the electrocardiogram here, the depolarization stage is prolonged. And also note the Q wave is also abnormal here. We have a long Q wave. So I will not discuss further in details what is a PQRST wave in an electrocardiogram. I'm just showing that the magnesium regulates the release of sodium and calcium. So if there is a retention of sodium and calcium, there will be a prolongation of the depolarization, and this is like a pain. You see you will experience a pain or muscle cramps. So this is a normal cell structure, and in the membrane, which is composed of a bilayer of lipid, we have this potassium. We have these several pumps that controls and regulates the electricity in our body and maintaining it to a resting potential. So if we zoom out the bilayer, this is the bilayer lipid. here, the inside of the cell is a negative charge, which is approximately negative 70 millivolts in neurons, and also positive outside. There are more potassium inside and more sodium outside. So magnesium also, magnesium ions inside the cell regulates the retention of sodium as well as the release of calcium outside, going outside the cell, so that the cell can bring back to a resting state. The magnesium is very important in the resting membrane potential. So these are the questions that I'm going to ask after we watch the slides. So in case study number 1, 59 years old male, notice here, this is the troponin. Whenever the graph is above 0.03, the patient has a myocardial infarction. But all of the slides are above. So all of the slides are having myocardial infarction. All of these patients are having heart attacks. So don't pay attention to this one because they have already heart attack. So pay much closer attention to the magnesium level. So the magnesium level at the time of attack is 1.7. The normal is 1.3 to 2.1. So if you check the magnesium, it's normal. So the blood pressure of magnesium when you test it is normal. So it is useless to check your magnesium. And magnesium is a commonly ordered test. It includes in the chemistry panel. So the magnesium result is useless. I don't know why this is included in the panel and this is useless. But during myocardial infarction, there is always a reduction of magnesium. Your magnesium is going down. That's what I have noticed. Reduction of magnesium. What is important in the cardio, what is important in the action potential, in the regulation of sodium and potassium and calcium is the intracellular free magnesium, because magnesium is composed of three types. We have this magnesium that is combined with proteins, conjugated, and also a free ionized magnesium. The free ionized magnesium is the one responsible for this myocardial infarction or pain or regulations of the sodium and calcium. Notice also it's 1.5. It's still within the normal but low side. The potassium also is in the lower side. The magnesium here is normal, but it reduced in the lower side of the mean. Lower side of the mean. Potassium is also normal, but lower side of the mean. Potassium here is 1.9, but it reduced to a level of 1.5. So these are extracellular magnesium. So if you are tested with magnesium and you are normal, it doesn't mean anything, because what is important is the intracellular magnesium. Now here, 75-year-old male, the magnesium is low. It's actually normal, 1.3, but in the lower side of the mean. Potassium is also in the lower side of the mean. Polar lower side, the mean is dropping. Look at the magnesium here. At the time of heart attack, potassium is on the low side of the mean. So what I'm showing here, actually, what is important here is not the snapshot or the level of magnesium at the time, but the reduction of magnesium. There is always a reduction of magnesium during myocardial infarction, and this is one of the reasons why for every 100 patients doing dialysis, one will die of sudden cardiac death because of the rapid reduction of magnesium, rapid reduction of intracellular magnesium. So even if your magnesium is normal within 1.9, if it's reduced so quickly, like in the case of dialysis, because you're taking in fluids, so the entrance of fluid in your body causes a rapid reduction of the magnesium, like for example 1.9 brought to 1.6. They're still within the normal level, but the rapid reduction is the one causing a pain in your myocardium. So all of these have a reduction, rapid reduction of magnesium, and the statistics shows on my study shows that 95% they are all normal within the normal range of magnesium, but 90% also they are in the lower side of the magnesium, meaning they're lower below 1.7. So if your magnesium is between 1.7 to 1.3, the external or the extracellular magnesium, the one that we tested, you're still within the normal, but you belong to 1.9, 1.3, and you are experiencing muscle cramps, pain, muscle twitch, then more likely you are deficient in magnesium. You need to eat more green leafy vegetables and beans and take supplements. 400 milligrams for men, 360 for women per day, so that your extra cellular magnesium will increase. And this increase can cause a chemical gradient where you have now more magnesium outside. So you will push, more likely push inside, increasing your intracellular due to pressure or due to chemical gradient. So your calcium is also 68% are low normal, but it's also in the lower side of the mean. High side is 21%, and I didn't say any pattern of the reduction of calcium, rapid reduction of calcium. So, in summary, you need to take magnesium every day. You need to eat green leafy vegetables and beans. If you cannot eat these 7 to 10 cups of green leafy vegetables, take supplement magnesium. You can buy any magnesium, except don't buy the magnesium oxide because it's hard to digest. So you can buy any type of magnesium except magnesium oxide. So thank you for watching. My name is Glenn Vale. Please click subscribe. And the next video I'm going to release about this coronavirus. So tell, I'm going to discuss how to protect yourself the coronavirus. Thank you very much.